Cancer rates are climbing at an unprecedented pace across the globe. More people are battling this disease than ever before in human history. Could you recognize the warning signals if your body was trying to alert you? Last year alone, over 1.9 million Americans received a cancer diagnosis. The truly shocking part, many waited until symptoms became severe before seeking help. Here's something medical professionals don't talk about enough. Catching cancer early increases survival rates by up to 90% for certain types. I understand the fear. That strange pain or unusual symptom sends you online, and suddenly everything points to cancer. This video is different. We're cutting through the noise with scientifically verified warning signs that have helped thousands detect cancer when it's most treatable. Your well-being is too valuable to leave to chance. Press subscribe now, start paying attention to your body's signals, and let me show you 15 crucial signs that could literally save your life. Changes in your skin. Your skin is your body's largest organ and often the first place warning signs appear. Unusual moles aren't the only skin concern worth monitoring. Recent research from Stanford University reveals that specific skin changes can signal internal cancers months before other symptoms emerge. Watch for persistent rashes that don't respond to treatment. Leukemia can cause distinctive spots called petechiae, tiny round marks ranging from red to purplish-brown. Unlike normal rashes, these spots don't blanch when pressed and often cluster where pressure is applied, such as ankles or under tight clothing. These appear because leukemia reduces your platelet count, allowing tiny blood vessels to leak. Medical researchers at Mayo Clinic found these skin changes present in 35% of leukemia patients before diagnosis. The spots typically measure 1–2 millimeters and persist, unlike common rashes that fade within days. And here's something critical, they're often accompanied by unexplained bruises or bleeding gums. Let's move to another visible warning sign that's frequently overlooked. Pharyngeal changes. Your nails can reveal surprising health secrets. Subungual melanoma, a dangerous skin cancer, often begins as an innocent-looking streak under your nail. Medical studies show these dark lines, known as melanonychia striata, require immediate attention when they appear suddenly. Unlike normal nail pigmentation, cancerous streaks typically continue to evolve and widen. These marks most commonly affect thumbs and big toes but can develop on any nail. What makes this particularly dangerous is how easily it's mistaken for normal trauma or fungal infection. Pay close attention to these warning signals. Dark streaks wider than 3 millimeters, varying colors within the streak, or blurred borders. Oncologists identify something called Hutchinson's sign, when dark pigmentation extends beyond the nail onto surrounding skin, as particularly concerning. Recent medical journal publications indicate this sign is present in over 70% of nail melanoma cases. Any nail changes accompanied by pain, splitting, or bleeding warrant immediate medical evaluation. The 5-year survival rate drops from 95% to just 16% when this cancer spreads before detection. Let's examine another visible warning sign that's surprisingly common. Jaundice. Have you noticed a yellowish tint to your skin or eyes recently? This condition called jaundice occurs when bilirubin builds up in your system. While jaundice can stem from various conditions, its sudden appearance in adults raises immediate red flags for pancreatic or liver cancer. Here's how it works. In pancreatic cancer, tumors can obstruct the bile duct, preventing bilirubin from properly processing. This backup forces bile into your bloodstream, turning skin and eye whites noticeably yellow. The color change typically starts subtly but intensifies as the condition progresses. What makes this particularly dangerous is the pancreas' deep location within your abdomen. This anatomical positioning means early cancer detection becomes exceedingly difficult. That's why recognizing jaundice, especially when accompanied by upper abdominal pain, dark urine, or light-colored stools, becomes crucial. Recent studies published in the Journal of Clinical Oncology found that 75% of pancreatic cancer patients exhibited jaundice as their first noticeable symptom. The research also revealed something startling. Patients who sought medical attention within 2 weeks of jaundice onset had significantly higher survival rates. But what about problems you can't immediately see? Mouth sores that won't heal. Your mouth reveals more about your health than you might realize. Mouth sores typically heal within 7 to 14 days. When they persist beyond this time frame, something more serious may be developing. Research from the American Cancer Society shows persistent sores, lesions, or white patches on your lips, tongue, gums, or elsewhere in your mouth could indicate oral cancer. This form of cancer can develop in any part of the mouth, including the lips, tongue, and throat. Risk factors dramatically increase with tobacco use and heavy alcohol consumption. Medical researchers at Memorial Sloan Kettering have identified specific characteristics of concerning mouth lesions. These include irregular borders, hardened texture, and surrounding tissue that bleeds easily. White patches in the mouth, medically termed leukoplakia, serve as another warning sign. These patches represent a precancerous condition that can evolve into cancer if left untreated. Though they might appear harmless, studies show 17% transform into cancer within 10 years when not addressed. Other concerning symptoms include difficulty swallowing, ear pain, or a sensation that something is caught in your throat. Early detection of oral cancer can increase the 5-year survival rate from 50% to over 90%. But sometimes cancer warning signs manifest as pain rather than visible changes. Unexplained pain. Pain without an obvious cause deserves your full attention. Pain signals that persist without explanation and resist standard treatments warrant professional evaluation. Your body communicates through pain when something isn't functioning properly. Medical research published in the New England Journal of Medicine reveals specific pain patterns associated with different cancer types. For men, unusual abdominal discomfort might indicate prostate, bladder, testicular, or penile cancer. Women experiencing atypical breast pain or sensitivity could be detecting early breast cancer signals. This pain differs from normal sensations and typically doesn't respond to usual remedies. Internal cancers produce distinctive pain signatures as well. For example, a persistent feeling of heaviness or swelling in the scrotum often signals testicular cancer. Similarly, ongoing abdominal pain might suggest liver or pancreatic concerns. These pain patterns are frequently dismissed or attributed to minor issues, but research shows they preceded diagnosis in 38% of cancer cases studied. Pain that awakens you from sleep or intensifies at night deserves particular attention. Recent studies show nocturnal pain patterns strongly correlate with certain cancer types, particularly bone cancers. This brings us to another specific type of pain you shouldn't ignore. Bone pain. Bone pain represents one of the most overlooked cancer indicators. Unlike temporary discomfort from exercise or minor injuries, cancer-related bone pain intensifies over time and often worsens at night. When cancer originates in or spreads to bones, it disrupts normal tissue structure, causing a deep, penetrating ache that's difficult to ignore. Primary bone cancer, medically termed osteosarcoma, typically affects long bones in arms and legs. The pain often begins subtly, resembling a sprain or muscle ache, but gradually becomes more severe and constant. What makes this concerning is how it impacts daily activities, making simple movements increasingly difficult. Patients typically describe the sensation as throbbing or aching that doesn't respond to common pain relievers. Research from the Journal of Clinical Oncology found that 85% of bone cancer patients reported pain as their first symptom. The study also revealed something concerning. The average time between pain onset and diagnosis was 7 months. This delay significantly impacts treatment outcomes. When bone pain appears with swelling, increased tenderness, or unexplained fractures, immediate medical attention becomes essential. Early detection dramatically improves outcomes, with survival rates nearly 70% higher when caught in initial stages. Another often overlooked pain can appear in an unexpected location. Eye pain. Your eyes provide crucial insights about overall health, including potential cancer indicators. Ocular melanoma, while rare, remains the most common primary eye cancer in adults. The symptoms begin subtly but can progress to noticeable changes that shouldn't be dismissed. When cancer develops in the eye, it creates distinctive symptoms different from common vision problems. You might experience blurred vision unresponsive to new glasses or notice strange light flashes inexplicable by migraines. The most concerning development is a dark spot on the iris that gradually changes size or color. Advanced imaging techniques can detect these changes before they become symptomatic. Research from the Ocular Oncology Center reveals people with lighter colored eyes or fair skin face higher ocular melanoma risk. Recent studies show that 60% of patients noticed vision changes at least 3 months before diagnosis. Regular eye examinations become particularly important with risk factors like prolonged sun exposure or family history. Early intervention can preserve both vision and life, with treatment success rates over 95% when detected before spreading. Another type of pain that deserves immediate attention impacts millions each year: persistent headache. Headaches affect nearly everyone occasionally, but certain patterns warrant closer examination. Headaches lasting more than 2 weeks despite medication require medical evaluation. These persistent headaches could signal serious conditions including brain tumors or other central nervous system cancers. Recent neurological research published in Lancet Neurology identified specific headache characteristics associated with brain tumors. These include increasing intensity over time, pain that wakes you from sleep, and headaches worse in the morning or when changing positions. Beyond the headache itself, watch for accompanying neurological symptoms. These might include blurred or double vision, hearing changes, facial drooping, or balance problems. If you experience any of these symptoms alongside persistent headache, immediate medical attention becomes critical. Seizures or unusual neurological events also require prompt evaluation, as these can indicate brain changes requiring immediate intervention. Brain tumors exert pressure on nerves and disrupt normal function, creating these distinctive symptoms. Recent studies show that 53% of brain tumor patients reported headaches as their initial symptom. The research also revealed something crucial. Those seeking medical attention within 1 month of symptom onset had significantly better outcomes. Let's explore another warning sign involving a different body system. Changes in bathroom habits. Your bathroom patterns reveal considerable information about your health status. Changes in urinary or bowel habits lasting several weeks deserve professional evaluation. These symptoms might seem minor, but can indicate serious underlying conditions including cancer. Recent gastroenterological research published in JMA identified specific bowel changes strongly associated with colorectal cancer. These include alternating constipation and diarrhea, narrowing stool diameter, and increased urgency. Changes in bowel habits might indicate inflammatory bowel disease like Crohn's disease. However, they can also signal colon or stomach cancer. These cancers disrupt digestive function, creating noticeable changes in frequency and comfort. Similarly, urination changes such as pain, increased frequency, or weakened stream might indicate urinary tract issues. These symptoms could signal enlarged prostate, infection, or more seriously, prostate or bladder cancer. A recent large-scale study tracked 10,000 patients diagnosed with colorectal cancer. The findings were eye-opening. 89% reported bathroom habit changes at least 6 months before diagnosis. Speaking of digestive issues, there's another common symptom many people ignore: persistent heartburn. That burning sensation in your chest might be more than just an uncomfortable reaction to spicy food. Chronic heartburn, medically termed gastroesophageal reflux disease, GERD, might seem merely inconvenient. However, when it persists despite lifestyle changes and medication, it could signal something more concerning. Esophageal cancer often first manifests as persistent acid reflux unresponsive to normal treatments. The relationship between chronic heartburn and cancer lies in repeated damage to your esophageal lining. Over time, stomach acid creates cellular changes in your esophagus, potentially leading to Barrett's esophagus. This precancerous condition significantly increases esophageal adenocarcinoma risk. Research published in the New England Journal of Medicine found that patients with persistent GERD had a 10-fold higher risk of developing esophageal cancer. Pay careful attention to warning signs like difficulty swallowing, food getting stuck, or unexplained weight loss alongside heartburn. If you've treated heartburn with over-the-counter medications for more than 3 weeks without improvement, consult a healthcare provider. Studies show early intervention can reduce esophageal cancer risk by up to 40%. Let's examine another digestive system warning sign too many people miss: blood where it shouldn't be. Seeing blood where it doesn't belong always warrants investigation. Blood in urine or stool should never be ignored, regardless of amount. Blood in stool may appear black, tarry, or red, while blood in urine presents as pink, red, or dark brown. These symptoms could indicate serious conditions, including cancer. Blood in stool may signal digestive system cancers such as colon or rectal cancer. It can also indicate inflammatory bowel disease or ulcerative colitis. These conditions disrupt normal digestive function, potentially causing bleeding. Similarly, blood in urine can signal prostate or bladder cancer. Research published in the Journal of Urology found that 91% of bladder cancer patients reported blood in urine as their first symptom. The presence of blood indicates something requires attention, regardless of underlying cause. If you notice blood in urine or stool, seek immediate medical evaluation to determine appropriate treatment. Addressing these symptoms promptly improves outcomes significantly across all potential diagnoses. Let's examine some systemic symptoms that might indicate cancer. Persistent fatigue. Unusual tiredness that doesn't improve with rest deserves serious attention. Persistent fatigue ranks among the earliest signs of developing cancer. If your energy levels have plummeted and no amount of sleep helps, something may be wrong. This isn't ordinary tiredness from a busy day, but rather deep, unrelenting exhaustion. This fatigue particularly indicates blood cancers like leukemia or lymphoma. These cancers affect blood and bone marrow, disrupting your body's ability to produce healthy blood cells. The result is profound weariness regardless of rest attempts. Research published in Cancer showed that 80% of cancer patients reported fatigue before diagnosis. More concerning, the average time between fatigue onset and cancer diagnosis was 7 months. Alongside fatigue, you might experience muscle weakness or confusion. These symptoms relate to cancers affecting hormone levels or causing internal bleeding. Persistent fatigue is frequently misattributed to stress or overwork. However, unexplained tiredness lasting more than 2 weeks warrants medical consultation. Fatigue represents just one systemic symptom that might indicate cancer. Persistent fever. Fever serves as your body's natural defense mechanism against infection. However, certain fever patterns might signal something more serious. A persistent or recurring fever without explanation could indicate blood cancer. Unlike typical fevers resolving within days, cancer-related fevers follow distinctive patterns. These often accompany other systemic symptoms. Leukemia and lymphoma trigger immune system releases of chemicals called cytokines. These caused frequent fevers without apparent infection. Research from the American Society of Hematology identified specific fever characteristics associated with blood cancers. These include temperature spikes at regular intervals, known medically as cyclic fever. When fever persists beyond 2 weeks or returns repeatedly without clear cause, it requires investigation. Blood cancers compromise immune function, increasing infection susceptibility while directly causing fever. Proper evaluation typically includes blood tests, checking for abnormal cell counts and disease markers. Recent studies reveal fevers preceded diagnosis in 43% of lymphoma cases, often by several months. Another systemic symptom worth monitoring involves unusual bleeding patterns. Excessive bruising. Bruises appearing without clear cause require medical attention. Excessive bruising in unusual body locations can signal certain blood cancers. If bruises develop without injury, consult a healthcare provider promptly. These bruises might indicate blood cell issues, particularly leukemia. Leukemia impairs healthy blood cell production, causing symptoms like excessive bruising. These bruises typically appear on arms, legs, or areas where injuries wouldn't normally occur. Research published in Blood demonstrated that abnormal bruising preceded diagnosis in 52% of acute leukemia cases. Beyond bruising, watch for frequent nosebleeds or bleeding gums. These also indicate potential blood disorders or cancers. Medical evaluation typically includes complete blood count tests, measuring platelet levels and clotting factors. Early detection dramatically improves treatment outcomes for blood cancers. Let's examine one final warning sign affecting the respiratory system: persistent cough or hoarseness. That nagging cough deserves attention when it persists beyond 2 weeks. A persistent cough or hoarseness lasting more than 14 days warrants medical evaluation. A dry hacking cough unresponsive to treatment might indicate lung cancer. Coughing up blood or bloody discharge requires immediate medical attention. Recent pulmonary research published in Chest identified specific cough characteristics associated with lung malignancies. These include nighttime predominance, absence of typical cold symptoms, and production of rust-colored sputum. Hoarseness or voice changes that don't resolve can indicate thyroid or throat cancers. If accompanied by swallowing difficulty or neck/throat pain, these symptoms become particularly concerning. Studies show these symptoms preceded diagnosis in 65% of laryngeal cancer cases. Persistent respiratory symptoms are frequently dismissed as minor issues. However, when these symptoms persist, they can indicate more serious conditions. Lung cancer particularly causes chronic coughing unresponsive to typical treatments. Early detection dramatically improves survival rates, with stage 1 lung cancer having 5-year survival rates nearly 4 times higher than late-stage diagnosis. Your health deserves immediate attention when something feels wrong. Knowledge transforms how we respond to our body's warning signals. Press the subscribe button now to receive evidence-based health insights that could save your life. Share this video with someone you care about. It might be exactly what they need to hear. Comment below with any health topics you'd like us to cover next. Your greatest asset is your health, and information is your most powerful defense. Stay informed, stay proactive, and take control of your well-being today. I'll see you in our next video.